Once we've established a diagnosis of prostate cancer, we bring the patient, hopefully with the relative, to listen to what we have to say, because prostate cancer is an unusual cancer in that many patients live with and don't die of their cancer. So it's important that you get a risk stratification to the patient. What is my risk of prostate cancer? That's of dying of prostate cancer. That is the first and most important question that he needs to understand. So we look at various things. We look at what your blood test level, this PSA test was. We look at what the biopsies have shown. We need to know how many of the biopsies have cancer. Because, for instance, if we took 12 biopsies and only a tiny bit of one of the biopsies showed cancer, that would be a very low risk to the patient in general. We look at this grade of the prostate cancer that we referred to, and if it's high-grade cancer, then that is obviously going to be a problem for the patient, where if it's low-grade cancer, a lot of patients with prostate cancer will live for 10 years without ever experiencing any problem with those cancers. So when we look at the patient, we're looking at those details that we've gained from clinical information. We also then need to involve the patient in the decision making. Many people have different things going on in their lives. So for instance, sexual function may be very important to a youngish man in his mid-50s, and he may wish to delay his treatment, whereas other men don't find that to be such a big issue. We need to know how medically fit people are, because in some people, the risk of, say, dying of heart disease or some other problem is greater than the risk of dying of the cancer, and therefore we have to tailor the treatment to the individual. And also we need to explain to a patient what the treatment options are, because it's not a one rule fits everybody. The patient himself may wish to say, I would prefer to have surgery. Some patients are very frightened of the concept of surgery and would rather have radiation treatment. Some people find that the idea of radiation and leaving their prostate behind them is upsetting, and they would prefer to have their prostate removed. And therefore there's a complex matrix of decisions to be made, and the patient himself needs to be actively involved in deciding what is the best treatment that he can have. And we need to impart the information. Particularly important is, what is my risk of dying of prostate cancer, and do I actually need an aggressive treatment which might cause me complications or not?